This conference will now be recorded.
Yes, 1 to 10. 1 to 10. 1 to 10. Any doubts? 1 to 10. Okay.
The 10th question, little bit doubt, sir.
Which code set is not used? Is not used by physician to identify diagnosis and procedures in outpatient? ICD-10 PCS. From that you are coding for outpatients. What are the code sets we are using?
No.
CPT, ICD-10 CM, HCPCS. Which one you are not using for coding?
Yeah, 10 PCS.
ICD-10 PCS. Okay, that is inpatient procedure coding system. Okay. Yeah, up to 10. Any questions? No. Up to 10. Any questions? Okay. 11 to 15.
Sir, 11th one, sir.
11th one.
Yes,
according
sir.
to
AR.
guidelines. Okay. Code range 76881 to 886. Which codes are reported for spectral and Doppler evaluation of the extremities? Doppler evaluation. Then A is the answer, right?
Yes, sir. But admin is and the answer is mentioned that B, sir.
B. 73700.
Yes, sir. But answer is AR, sir.
A is the correct, sir.
Let me.
Is it the page number 540? It is mentioned, sir.
Mentions.
A is the correct answer.
Okay.
Yes, sir.
Next, 12th question. D for Delhi is the answer. 12th question. D for Delhi is the answer. 12th one. D for Delhi is the answer. 13th one. A. A is the answer. 13th one. A is the answer. Now 14th one. Can you tell me what is the ICD code? 14th question. First degree burn of back of hand. What is the ICD code?
T23.169.
T23.169A. Let me check. First degree of back of unspecified hand. Initial encounter. 1 second. Back of hand unspecified, right? Yes. Yeah, correct answer. T23.169A. T23.169A. Now, what is the CPT code? If you go for integumentary system, you will find the burn related. One six triple zero. 16000. 16000. Next one, 15th question.
How we
Is
sir, this 14th question, how we should check in a CPT code?
Go for directly burns in the index list CPT book.
Okay, sir.
In CPT, go for burns directly in the index at the end. It will lead to integumentary system. Or in integumentary system index list, there is a burn related concept. Okay, from that also you can search. Okay. 15th question, B is the answer.
Sir, what is the ICD code, sir?
T23.169A.
Where will you find that, sir?
Sorry?
How we search that? How we can search that, sir?
See, I already told you in ICD-10 CM how to search a code. Go for
CPT.
burn is the main term. You are asking about CPT or ICD?
ICD, sir. ICD. CPT is clear.
Go for burn is the main term. Then hand, in hand, back of the hand, then first degree, you will get the code.
Okay, sir.
Question number 15, adverse effect is the answer. Question number 15, adverse effect is the answer. In adverse effect, we cannot use
T code.
we cannot use T codes as the primary diagnosis. Okay.
No non-optional questions also can be asked in CPC like 14.
No, just I have given. They definitely they will give options A, B, C, D. Okay, no issues. Okay, up to 15, any doubts? Up to 15, any doubts? No doubts. 15 to 20. 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 No doubts, no one. 20 to 25. Up to 25. Check everyone. Up to 25. Up to 25. Up to 25. See that compliance and regulatory, don't worry about it. We will give you the questions what you are getting in the examination. We will try to give max 3 questions you will get, right? No need to focus on compliance and regulatory. Those 3 billing questions, we will try to provide you the questions by asking others who are writing the exam. Up to 25. Up to 30. Up to 30. 30.
Sir, in E&M, I am not getting how to code this 203 and 214 that code, sir. Can you please explain how to code like using table, sir?
Which question you are asking about in the 30th up to 30?
Up to 30, I got 29, 30, 31 wrong, sir.
Okay, you are asking your doubt is in 29, right?
Yes, sir.
29, 30, right?
Yes, sir. 29,
Okay.
30 and 31 also, sir.
29, 30, 31. Okay. Up to 31, any other doubts? Up to 31, any other doubts? Okay, let's check. 3. Go for 29. The provider visits his patient in the hospital on the morning round and spend 20 minutes with the patient. Later, the same day, he sees the patient and discharges her from the hospital. Now, can you look into what are the 5 basic rules when I am teaching E&M? What is the first point you need to understand? Where is the patient here? In question number
Inpatient, sir.
29, inpatient. That means they are going to discharge the patient. Yes, sir.
Yes. Yes, sir.
Discharge codes are based on time, as you know.
Yes, sir.
How much time spent by the physician on the day of discharge?
40
20
minutes.
minutes.
How much time he spent by physician on the date of discharge? 40
40
minutes.
minutes, sir.
Initially morning 20, at the time of discharge 40, total 40 minutes. 40 minutes, what is the code?
Yes.
239.
Understood now? Correct. But
239
is
I coded,
it
sir,
clear
but
now,
uh,
Kalpana?
but in key they
Huh?
gave 234, sir. I coded 239 only.
Okay, okay. Then correct it is 239. 29C is the correct answer.
Okay, sir.
No, it is like discharge,
Okay.
admitted and discharged on same day, na? Patient is admitted and
Admitted
discharged
and
on the same
discharged on the same day, where the provider visits his patient in the hospital.
day.
Visits his patient in the hospital. This verbiage tells you already he is in the hospital on the morning rounds and spends 20 minutes with the patient later the same day. This is all about they're asking about discharge service, not admitted and discharged on the same day.
Okay.
So
Where is
239 is the
admitted and
correct
discharged?
one, no, sir.
239 is the correct one. They're asking to code only for discharge service.
Yes, sir.
Okay. 29C is the
Yes, sir.
answer. Next. Question number 30. Go for these quotes, Kalpana. Where you are finding
Sir.
these quotes in your textbook, go for these quotes.
I got for 99493, sir.
Okay, I will show you. See, it's a directly there is one table, Kalpana, for time. You just go into the table.
39D na sir.
Which
85
one?
minutes na. 35D. 30D. 30D.
Let me check. What are the quotes list? 99?
99493 492 494.
Can you see this table on my screen? Can you see this table on my screen? Yes
Yes,
or
sir.
no? Now this is an
Yes, sir.
initial visit or subsequent visit in the scenario. It is an initial visit, right? If you see
Sir.
a 31-year patient sees his treating physician, the total time spent with the patient is 85 minutes, right? Now 85
Yes, sir.
minutes, 85 minutes. Here is the 85 minutes. 99492.
Sir. Okay.
99492. Where it is? Option B.
Yes, sir. Sir, actually, I thought it was subsequent, sir, because in questions, he's his treating physician, they gave no, sir. So I thought it is subsequent visit. Hello.
Yes. Just I'm checking.
Sir, in question they have gave sees his treating physician. They gave no, sir. So I thought it was subsequent visit.
Yes, but in the same calendar month or not, just I'm checking for you the proper way.
Okay, sir.
See, they need to document in the same calendar month. Understood? These services will be reported
Yes.
for calendar month. The codes are not based on new patient and established patient. Understood? Kalpana.
Okay, sir. So
If it is
yes, sir.
new
Yes, sir.
patient or established patient, we can say, okay, see his old patient. It is not like that. It is based on initial and
Yeah.
subsequent visit. Means within a particular period of time he is coming for the second time. You can say it is a subsequent visit.
Yes, sir.
Okay. Then the particular period for the scenario is a month. A month. Within a month he is coming for repeatedly. Then it is a subsequent visit. See, they
Oh,
don't confuse you in the exam. They will give clearly in the exam as a subsequent. Okay.
okay, sir.
Okay. Up to 30. Any questions? Up to 30. Any questions? Anyone who have joined recently?
Sir, answer is 35.
30 B for Bombay.
Why D, sir?
What is your answer? Why?
D. Why not?
Why?
D.
Why not D? See, you can
Yeah.
see my screen, Sunil. What is the range? 85 minutes, right?
Yes, sir.
85 minutes comes under 36 to 85 minutes. What is the code? Only 99492. When you need to take
Okay.
99492 and 494, the range from 86 to 115 minutes. But what is the time provided in the question for you? 85
85
minutes,
minutes.
right?
Okay,
Then
okay, sir.
only 99492. Up to 30.
Sir, can you
30.
explain
Any questions? Question number? Sunil, what's your question number?
31, sir?
31. Yes, I will explain. Up to 30, any questions? Up to 30, any questions who have joined recently? No questions? Okay. Now see 31st question. Option A, established patient, new patient, established patient. 26-year-old patient presents to his long-time family practice physician Garrett, complaining of left arm pain at bedtime. Patient was last evaluation by Garrett 4 years ago. See, he evaluated the patient when 4 years ago. Now he is coming, right? After 4 years, that means what is the time period for new and established patient? 3 years. Now he is coming after 4 years. That means he is a new patient or established patient?
Established patient.
Sunil. What is the time period
Previously,
for new patient and established patient? 3 years is the time
pre-
period, right? He is coming after 3 years. That means he is a new patient. What is the patient? New patient, right? Comprehensive history, comprehensive exam, low MDM is provided. Now low MDM comes under 99203. Low MDM comes under 99203.
yes, sir.
B is the answer. B is the
Okay.
answer. What is the doubt here, Kalpana, for you? 31.
I think
I
he
think
was
it is
established
double line
patient.
two. Yeah.
How can you take it as established, Sunil? Go with the basics. Read the notes, everyone. Yes, Kalpana, what's your doubt here? 31.
Nothing, sir. I too thought as established patient only, sir.
That means
So
you are
I
not
got
revising. First,
double line.
revise the notes. Revise the notes. Okay. Then you will get lot of
The revised.
clarifications. First,
Yes, sir.
Okay.
There I wrote as years only, but
Okay.
4 years means I got a little bit confused.
Okay.
Okay, sir. Now I got
Yes,
clarity.
Sandhya Rani. Okay. Sandhya Rani, what is the doubt in 14th question? The codes, the codes I already told. CPT code is 16000, Sandhya Rani. ICD codes are, let me check. I already told them, but anyway, we'll repeat. T23.169A. T23.169A. Okay. Up to 30, any doubts? Okay. 30 to 35. 30 to 35. Just text me your question numbers. 30 to 35. Remaining people, whatever you are having doubts, text me your question numbers. Up to 35. 35. Up to 35. Up to 40. Okay, 33. 33. A patient who suffers from chronic left low elbow pain, high energy, extra shock wave. What is the CPT code reported? See, if you are going to get a code from category 3, you can code it, Geeta. What's the doubt here? It's a direct question, right? No? Okay. You can tell me the codes, Geeta. But you can tell me the codes. What is option A in 33?
010 IT, sir.
0101T, not IT, 1T. It is category 3 codes, right? Now can you see what is the definition here? Extracorporeal shock wave involving musculoskeletal system, not otherwise specified. You can see the question that is provided for musculoskeletal system. Extra shock wave therapy for musculoskeletal therapy. Okay, then we will see the next code also. What is the next code? Option B.
28890, sir.
28890.
I coded this one, sir. 28890.
Corporeal shock wave, high energy, performed by a physician or other qualified healthcare profession requiring anesthesia other than local, including ultrasound guidance involving the plantar. Can you see clearly below parenthetical notes have given for you? For extracorporeal shock wave therapy involving musculoskeletal system not otherwise specified as use 010T or 0102. Integumentary system it is 0512. But here the one is high energy. A is the correct answer, Geeta Kumari. Why you went with 28890? Is there any ultrasound guidance, fluoroscopic guidance, anesthesia they are talking about in the question?
No, sir.
No. And they are performing for what? Musculoskeletal therapy?
Yes, sir.
See, 8890 is performed by physician, and then you can say there were a lot of verbiage is there in 8890. 8890, if you see, read the code description properly, it is saying about extracorporeal shock wave, high energy, performed by a physician requiring anesthesia other than local, including ultrasound guidance, involving the plantar fascia. Where is this all about plantar fascia and everything? No, right? Just what they are telling about 010T, right? If you go and read the code description, that is exactly matching with your procedure performed. Okay, they're performing for ESWT for musculoskeletal therapy. Understood? Here there is no plantar fascia, and again, why I am telling there is no plantar fascia, because if you see in the reason for visit, where is that a problem the patient is having chronic left elbow pain? Yes or no, Geeta?
Yes, sir.
If it is chronic elbow pain, then plantar fascia comes under foot. Yes,
Yes,
sir.
sir.
Okay, then also we can rule out that 28890. Is that clear now?
Yes, sir. Yes, sir.
Okay. Understood now, Geeta? You got some clarification? Okay.
Yes, sir.
Yes. Next question number up to 35. Up to 35. Okay. 35 to 40. Someone have asked 38. 35 to 40.
Sir,
35 to
36.
40. 36. 36.
I coded 01402, sir.
Okay.
01402, it is showing as anesthesia for open or surgical arthroscopic procedures of knee joint, total knee arthroplasty.
Okay.
So
Then what is
why
the answer?
01400, sir? According to the key.
01400. Anesthesia for surgical operation on knee joint not otherwise specified. What is your answer? 014?
02.
01402. This code is used for TKA, not for ACL procedures. Total knee arthroplasty.
Yes, sir. So
Total
I thought
knee
lateral
replacement.
mani.
Lateral? Yes, please.
In the
Lateral.
ACL reconstruction and lateral meniscal repair they gave, no, sir. So I thought as total knee arthroplasty.
No, only one portion of the knee. Knee consists of 3 compartments. In between knees, we call it as medial. Then sides, we call it as lateral. In middle portion, we call it as patellofemoral. Okay, and there are 2 ligaments, ACL and everything. See, total knee arthroplasty, knee replacement. Then you can use that code. Okay.
Okay, sir. So they will clearly mention, sir, total knee arthroplasty.
Yes. Knee replacement. They will mention. Patient is coming for knee replacements. Like, okay. Yeah. That up to 36. Okay. Any doubts? Up to 36. Any doubts? No doubts. Next 38. Is Srileka 38. An ultrasound of the transplanted kidney is performed without a duplex Doppler. How is this coded? I think so it's a straightforward.
Sir, that in this question you have mentioned complete.
In this question? Okay, let me check. Let me check the code.
Retroperitoneal renal is kidney.
Okay. 76775 ultrasound retroperitoneal. In that it may be renal, aorta, real time with image documentation, limited. Okay.
Yes.
76700.
It's abdominal. Real time with image documentation complete.
Little bit
Okay.
confused about
Here it is
complete or
a,
limited.
it is a transplanted kidney they're performing on.
Without
See, why people are opening your minds. Can you see my screen? If you go with the code description 76776,
Okay, sure.
are you
Real
there, Sri
time
Lanka?
and do.
Can you see there is a parenthetical note for you under 76776 in your textbook also? For ultrasound of transplanted kidney without
Without a Doppler.
duplex Doppler, what is the code they're asking you to put? What is the code they're asking you to quote? 76775. An ultrasound of the transplanted kidney is performed without a duplex Doppler. Then what is the code we need to use?
76775.
Oh, that's it. When you are going through each code also, I said the basics. See parenthetical note. You will get a guidelines mostly in parenthetical notes itself. Now you understood what is the code you need to capture.
Okay, sir.
What you have coded, you
Complete
can tell
limit.
me.
76557
Complete.
sir. 76555. Limited. I
మీరు ఏం
coded
కోడ్
limited, sir.
చేశారు?
Retroperitoneal renal. Renal means kidney, sir. I coded a
మీరు
double
ఆప్షన్ ఏనే కోడ్ చేశారు?
76775. ఆ ఆప్షన్ ఏనే సార్, కానీ ఇక్కడ కంప్లీట్ ఆర్ లిమిటెడ్ మీన్స్ నాకు అక్కడ అర్థం కాలేదు, అందుకే అడుగుతున్నా.
కంప్లీట్ లిమిటెడ్ గురించి మీకు అర్థం. అక్కడ మీరు వెళ్ళే 76775 వెళ్తే అక్కడ ఏం లేదా టెక్స్ట్ బుక్ లో?
ఓకే ఓకే సార్. సింగిల్ ఆర్గన్ 76705 సింగిల్ ఆర్గన్
ఉంది కదా?
ఓకే ఓకే, థ్యాంక్ యూ సార్.
Next, up to 40. Text me your questions where you are having doubts. Up to 40. Text me the question numbers up to 40. Any doubts? Up to 40. Up to 50. 42.
Sir, in 41 we need to consider it as bilateral, sir. 41.
Yes.
Left femoral 41. And right iliac.
See why bilateral here? To understand the 70 series, you want bilateral.
Sir,
36 series not regarding bilateral. You quoted.
7 in answer C, 75710 is unilateral and 75716 is bilateral, sir.
Okay. A patient who may have blockage in the right leg is undergoing an angiogram in which the left femoral artery is cannulated and advanced into the aorta and then into the right external iliac artery. Contrast is injected. Both sides are examining, right? Right and left?
Yes, sir.
Contrast material?
Yes, sir.
Then bilateral only?
Yes. Okay, sir.
Yes, he asked 42 Sunil Kumar. What is the doubt in 42? A 50-year-old examination couple thyroid nodules without clinical symptoms of hyperthyroidism. Blood thyroid function indicates euthyroidism. The physician images the thyroid gland by intravenously administering radioiodine. Multiple images are required from different angles and documenting the patient position, vascular flow around the nodules, looking to determine benign, malignant. What radiology code is reported? See, what is your answer? What is your answer, Sunil?
42, yes, sir.
A.
78013.
You quoted A.
Yes, sir. But key is D.
C. Patient is having malignancy or not? Patient is having malignancy or not? You can tell me first of all.
Yes, sir.
That's why they perform the test to determine benign or malignant flow characteristics.
Okay.
What is the reason for the test? What is the reason for the test?
Thyroid imaging, sir. Or
Okay.
carcinoma of cancer.
What is the reason for the test? Neck and
Thyroid
chest
cancer.
hormones. D is the correct answer. What is your doubt? I'm not getting. They are testing for thyroid carcinoma, and the test is performed in neck and chest region only, or any other region. Thyroid nodule means it is the neck region, right? With clinical symptoms indicates euthyroidism, thyroid gland intravenously, radioiodine, documenting the patient position, is looking
Mohan,
to determine.
Mohan, they have
Yes,
documented vascular flow, na? In that
yes,
nodules, they have
yes,
only one vascular flow. So 78013 would come, na?
yes, yes, I'm checking if it is for carcinoma or not. The vascular flow is in around the nodules is looked to determine benign from malignant flow characteristics. What radiology reports are report. Seven 78013 is the correct answer. How many of you coded 78015? How many of you coded 78015? How many of you coded 78015? No one is coded 78015. Everyone is coded 78013 only.
Yes, sir, 78013. It's first floor flow.
78013 we have coded, sir, but
Okay.
after seeing the key, we got confused between 13 and 15.
13 only. 15 means when you will go for 15 means already they diagnosed the patient as a carcinoma patient. Then in carcinoma patient they are doing the test, you can go for 15. But in the scenario there is no carcinoma to the patient. Understood? They're just looking the vascular flow in the nodules to determine benign from malignant flow characteristics. Yet to determine benign from malignant flow characteristics. We just take it as 78013 only. Understood everyone? Next up to 45. Up to 45. Up to 45. Up to 45. No questions. Up to 50. 50. Up to 50. 50.
Sir, 47.
47. 88160, right?
Sir, I coded as 88162, sir, because they gave a total of 4 sputum strains, they gave, sir. So I
Huh?
coded 88162.
162. Okay.
Sir, I also coded for double A.
Let me check. Let me. See here, minimum 5 slides they required. Yes or no? Minimum
Sir.
5 they required. Okay. Less than 5 you can go with 88160 only. Interpretation and report 160. You can see cytopathology is mere any other source. Screening and interpretation.
Yes, sir.
Minimum 5 if they
So,
documented, then you can go with that code.
okay, sir. Sir, and one more doubt. In 88162, there is a parenthetical note, sir, for aerosol collection of sputum.
Okay.
So, in also they gave sputum, no, sir. But they didn't give that option. I just got confused about 89220.
See if they provided regarding that option, then you can think about it. Otherwise, no need to think about that option in the examination also. Okay,
Yes,
that is
sir.
not
Yes,
an answer. That means, okay.
yes, sir. And in 48 questions,
Huh.
I coded as A, sir, into 12.
Okay.
So, why
Into
we
12.
should not?
See, when you are seeing the codes 80305 I said go and see the rules in your book pathology. Report only once. If n number of tests they are performing. If they are going to perform 30 also, we need to report only once per day. If you even read the code description, you came to know. Read the code description. Read the code description.
Sir, 1 minute.
Make it fast. You can remaining people you can text your doubts. 50 to 60. Remaining people you text your numbers up to 60. Any doubts you are having. Have you read the code description? Okay, if you read the code description, you came to know only one time we need to report. Okay. Next one.
Okay.
Question number 49. 49. Who is having doubt 49? What is the doubt here? One is into 20 times is there. One is 20 times 573 567 96567 96573. 20 actinic keratosis. Yes. Here.
Physician assistant
Applies
means
the reasons for photosynthesizing drugs to the lesion. The physician asks the patient to come back later in the day of following application of the drug. When the patient returns later that day, the physician assistant then exposes the area to blue light. The photosynthesizing drug in the lesions absorbs the light. 96573 567.
sir here physician assistant means other qualified professional, sir.
Other qualified? Yes.
Not directly by the
Non-physician practitioner. If you see 96573 external application of light destroying skin or mucosal photos and provided by physician or other qualified healthcare professional. That is one. Next one another option is 96567. See, can you see here? Application of light to destroy pre-malignant lesions of the skin with application and illumination or activation of photosensitive drugs per day. Now try to see the code description, what they are doing. In the day of application of the drug, when the patient returns to the scenario. See, what's your doubt here?
Sir, here mentioning as physician assistant means what,
Okay.
sir?
Physician assistant means other. He's a qualified person only.
Okay. So we will take provided by a physician or other qualified healthcare professional.
Yes.
Okay, sir. The answer is
That's your doubt. Okay. What you have coded previously?
96567, sir.
567 you have coded.
It is not directly involved. So like that I thought, sir. I coded 96567.
Okay. No issue.
Technician.
Sir, here also we no need to code into 20, sir.
No.
Only per
One time.
sir.
On a day. The codes are about days, right? Per day.
Yes, sir. Per day.
96563. Here in the same day they provided 20. If you report it, for example, into 20 times means they provided for 20 days. Is the scenario providing for 20 days? Okay, no, right?
No.
Next, up to the next one, few people have asked me 57. 57 is a single layer repair is performed to close a 5 centimeter laceration on the right leg that requires copious irrigation and extensive cleaning. A layer with extensive cleaning or debridement comes under intermediate repair. Intermediate repair, either A or D is the answer. What's your doubt, Ashok, here?
Yes, sir.
Sir, if this single layer is repaired perform is only simple layer, sir.
Single layer, but extensive cleaning. A layer with extensive cleaning and debris. Layer with superficial cleaning, it is simple repair. A layer with extensive cleaning or debridement comes under intermediate repair.
Yes, sir.
Okay, sir.
Okay. That point I said, I think so. Just look into your notes. The differences. Up to 60. Up to 60.
Sir, 52 question.
52. What's your doubt here? Patient is the vision suspects.
Modify 50 and 59, sir. Bilateral procedures, 59.
59. Why we coded 59? That is your doubt?
Yes, sir.
Yes.
Why? Because those are two different parts.
But CPT is mentioned in 93923 in complete bilateral non-invasive physiological studies of upper or lower extremities of arteries.
Okay. That's why only A is enough, no need to code D. That is your question?
Yes, sir.
Okay. A patient is seen in the radiology clinic for numbness and tingling of both arms and legs. Both arms and legs. The vision suspects it is related to. The radiologist performs a complete lateral by multi-level segmental wave analysis on the ATS, both upper and lower limbs. Both upper and lower limbs. 939. Complete bilateral non-invasive. When only one arm or leg is available for study, report 939.
Dance of
939 only once in upper extremities and or once in lower extremity. When you can see how you people will ask me these simple questions. అంటే మీరు ఇంటి దగ్గర అసలు ఏమీ చేయట్లేదు, తప్పు చేస్తే ఇంకా తప్పు అయిపోయినట్టు అంటున్నారు. కింద పెరాంథటికల్ నోట్ ఉన్నదా మనకి? బేసిక్స్ ఫాలో అవ్వండి అందరూ. బేసిక్స్ 93923 కింద try to see 93923 below. Report 93923 only once in the upper extremity and or once in the lower extremity. When both the upper end extremity and lower extremity are evaluated, report twice by adding 59 modifier to the second procedure. ఇంత క్లియర్ గా ఉంటే మళ్ళీ అది ఎట్లా తప్పు అంటున్నారు మీరు? Understood what I am saying, everyone?
Yes, sir.
See, clear there. See parenthetical note. See the code description properly. Basics strong one. Okay. Next question number up to 60.
54.
Sir, in 53, why we
Yes.
should not take C, sir? C option 96415.
See, if you go and see the parenthetical note again under 96413 beyond 30 minutes, it will clearly documented there. The add-on code will come only after minimum interval is 30 minutes.
Sir, here up to 1 hour in 96415, each additional hour they gave, sir.
The 96413 below parenthetical note. Try to see parenthetical note at 96413. Are you finding any beyond 1 hour?
No, sir.
Are you able to see Kalpana? No.
Below the 96415 is parenthetical note is there. Please check once.
In 415
Below 96415 also you are not finding any parenthetical note?
is there, sir. Report if our
Then
information
Kalpana.
greater than 30 minutes. Okay, sir. Only after greater than 30 minutes we need to report it.
Add-on code. Add-on
Yes,
code
sir.
will come minimum 30 minutes after 1 hour. Okay.
Okay, sir.
Yes, up to 60.
Sir, 54. 54 ARC, sir.
What is your
Answer.
9296.
I coded
Okay,
C, sir.
929. Okay. Cardioversion elective. Okay. What is your answer then?
I coded C, but in option it is A.
You coded D. D for Delhi.
C, sir.
B for Bombay.
92970. I coded.
C. Cardio assist method of circulatory assist internal. Now read the question that is performed there. 65-year-old ED, 2 paddles are placed on the patient chest. That means internal or external? Patient's chest means internal or external?
External, sir.
External. Directly they are giving shock. Then directly it leads to 92960.
Okay.
Understood.
Okay, it's clear.
Next up to 60. Ashok, you have asked about 57. Is that clear, right? I cleared already. 60. Up to 60. No doubt. 61 to 65. 61 to 65. 61 to 65.
Sir, in 55th question. Sir, in 55.
Again, you are going back. Yes. Yes, Vishnu. 55.
Sir, about modifier 78 or 58, sir. I have given 58
planned treatment. If it is a planned treatment coming in the post-operative period, 58. Unplanned treatment coming in the post-operative period, 78. A 40-year-old patient, type 1 lower weight debridement crafted last week. She is scheduled to return. She is scheduled to return to the operating room for split thickness autograft. Scheduled to return means what? It's a planned or unplanned?
Planned.
Planned. What is your answer? You coded D.
I coded 58 modifier A.
Okay.
Yes. Confusion about modifier, sir. Not the code.
That means you coded correctly or wrong? You
I
coded
coded
correct
wrong.
only, right? Then
No.
scheduled means it's a planned visit, Vishnu.
Okay.
Scheduled means it's a planned visit. Suddenly they are coming. That's an unplanned return in the post-operative period. At the time 78. Understood? If a procedure done to a patient, he went home, he's feeling some infection, suddenly he came back again to the hospital without any appointment. Then
Okay.
78. Here they're scheduling. Scheduling means what? It's a planned treatment.
It's a planned treatment. Then 58 will come. Modifier.
Yes, 58. As we discussed, 58 is a stage-related planned procedure performed in the post-operative period.
Okay,
Check
sir.
the modifiers. I made you difference also when I'm telling the notes. Up to 65. Up to 65. Up to 65. 70. 70.
Sir, 65.
Patient sustained a fracture of the humerus shaft in the right arm. After being a TV accident, the ED physician assesses the humeral fracture and determines the fracture does not require a reduction. The ED physician immobilizes the right arm in a splint to hold in position for healing. Apply CPT guidelines. What does see here in this total scenario? Always keep in mind, I said initial application of cast or splint is a part of the procedure. If you go and see 24505, initial application along with that code, do we need to code splint again initially?
Okay, no.
No need to code, then B or C in that one will be your answer. Based on that you can select. Understood?
Okay, if it is subsequent visit, then we need to code the splint.
Then application of cast or splint you can code separately.
Okay, sir.
Hello.
Yes.
Sir, in 65th questions, reduction means with manipulation, sir.
Yes, with manipulation. But here they are not performing any reduction, right? Does not require a reduction.
But answer is 24500, sir.
What is the code description of 24505?
With manipulation or without skeletal traction, sir.
24505, right?
Yes, sir.
24500?
Without manipulation.
Closed treatment or humeral shaft fracture without manipulation, sir.
Now here they're performing without manipulation only.
Yes, sir. But
They're
answer
not
is
doing reduction.
key term is answer. Key term is only C.
See, as you said, 24500 is the answer, right? 65C
Yes,
they given as the answer. 24500 there is no without manipulation, right? In the code description.
Yes, sir.
Without that is the scenario going on. Does not require a reduction. They're not reducing. That means what? Without manipulation.
Okay, sir. Yes, sir.
అశోక్ అర్థమవుతుందా? నువ్వు చెప్పిన
Yes sir,
ప్రకారం
yes sir. Yeah.
వితౌట్
Yes sir, clear.
మ్యానిపులేషన్ అక్కడ రిడక్షన్ చేయటం లేదు కదా, అప్పుడు వితౌట్ మ్యానిపులేషన్ తీసుకోవాలి. నెక్స్ట్ అప్
Yes
టు
sir, clear.
70, అప్ టు 70, అప్ టు 70.
Sir,
Sir?
67. 67.
This
Sir,
is
in 5 questions, sir.
question number.
In 65th question, why we
Okay.
did for splints, sir? 29105. There is no rule
This-
for.
Susmita, when I am teaching a musculoskeletal system, please open your notes and see the rules what I said.
Okay, sir.
Initial application of cast or splint is a part of active treatment. I said that rule. Just go through the rules in text in your notebook. Next question number 67. 67.
Sir, 67.
See, clearly they are telling transluminal stent placement is going on, atherectomy is going on. That comes under C option. Just check. Okay. What is your answer previously? What is
Previously,
your
D.
answer?
Sir, what is
D.
the difference between 37229 and 37233, sir? Both are the same codes.
How can it will be both are the same codes? Definitely there will be some difference.
Same code description, sir. 37233 is add-on code.
Add-on code. That means add-on code means 2 more vessels. That means the same procedure is repeated in 2 vessels. Then you need to use that add-on code. Understood what I am saying? The same procedure must be repeated in one more thing. But here, how many total involved? High-grade left suprafemoral artery stenosis and also separate stenosis in the tibioperoneal trunk. Two are involved, right? Is that clear what I am saying? One is femoral artery stenosis, another one is tibioperoneal trunk stenosis. Right
Okay.
femoral artery is made and sheath instead posterior tibial artery atherectomy, stent placement, occlusion, atherectomy site next, peroneal atherectomy device. Peroneal they are doing some atherectomy and there they are placing stent. Only 2 are involved here. No need to go with the add-on code. C is the correct answer. Next, up to 70. Again read the question, Vishnu, you will understood now. Okay. Question number 70. Up to 70. Up to 80. 80. 70 to 80.
Sir, in 69. Sir, in 69. 69. In this procedure, endoscopy is not used, so we need not to code for
Open.
31. Sir.
Open method. Open method. Open method. Okay. Not 31255. Something it may be 201 or 202. I think so.
201.
Like that you can go. Okay.
Okay.
Up to 80. To 80. 80. Up to 80. Text me your questions. Those people who are having doubts up to 80. Text me your question numbers. See, whatever the mark you are doing, if for example you are going to do 20,000 series, first open your notes and see any rules. After that you can do 20 initially up to 3 to 4 marks, so that you don't do any simple errors, everyone. Up to 70. Sorry, up to 80. Up to 80. 80. Now you can send me your scores privately. Okay. Okay, last 10 questions I need to cover down. Yes, yes. 80. 80 you are having doubt, right?
83, sir.
Okay. 83. Yeah, I will come up. Up to 80, any questions? Up to 80, any questions? Okay. 80 to 85. 80 to 85. Now you can ask me your question. What's your question?
Sir, in 83, by seeing this question, how can we differentiate whether this procedure is simple or complicated?
First of all, what are the codes? Which code it is telling about simple or complicated?
51703 and 51702.
Both are temporary indwelling catheters.
Both are the same, but differentiate is about simple or complicated.
Okay. See, can you see clearly they have given in parenthetical note? Fractured catheter or balloon, altered anatomy, the structure is totally different. Then it will be complicated. Understood,
Okay.
Vishnu?
But in question they have not mentioned the Foley also, no sir. Then how can I differentiate?
Then it is by default there are two codes for temporary indwelling catheter. One is 702 and 703. Yes or no, Vishnu?
Yes.
In 703 is not your answer. Then what is the remaining option with you in front of you for temporary indwelling catheter?
Only one, that is 702.
Then that will be your answer.
Okay, but in question they have not mentioned Foley and they have also not mentioned altered anatomy, so I have confused.
Then by default go with the Foley. That is the simple method. If they are not doing complicated method, then what they have done? They have done simple method.
Okay, sir. Okay.
Up to 85. Up to 85. Up to 90. Up to 90. Up to 90. Now we can see from 91 onwards how to do. 88. 88 you are having doubt, Sunil. What is the doubt in 88, Sunil? They are doing, you can see, 67332 is the answer, I think so. 67311 will come.
But answer is given B, sir. That's why I am asking. I am placed
Answer
6
is
on
given
double
B.
32. Yeah.
C is the correct answer. Make it as C. Sorry.
My answer is C, but here key is B. That's why
343 is a separate procedure. 343 is a separate procedure. It is not a 1 minute. Then okay, 1 minute. I will check then. 67343, right?
Yeah, sir.
343 is the correct, sir.
But 6 on double 3 is correct, sir.
When we can use this 343, if it is the procedure, the primary procedure is performed on an affected muscle, then no need to code. When it is performed other than an affected muscle, you can use that one. Okay, you can code correctly. What is that one? C is the correct answer. Sorry, C is the correct answer. 88, C is the correct answer. Understood now?
Yes, sir.
See here the scar treatment they are performing on the affected muscle. One second. Is the same affected muscle? Both are same. Can you read the scenario? The physician resects the medial rectus muscle of the eye and secures with sutures. That comes under 67311. Is that clear, everyone? Then Extensive scar tissue is noted due to previous surgery. Where is the scar tissue? On the same affected muscle or different muscle? Different muscle,
muscles.
right? Then if it is different muscle, then 343 only right answer. What's your doubt, Sunil, here? Why you coded C?
Sir, if different muscle also we cannot consider 67332.
No, if you see 343 clearly they are stating if extensive scar method is performed on a different muscle, that means not the treatment provided muscle, you can use 343. Correct, only B is the correct answer. 67332 to write. It is on the same muscles. Strabismus surgery on patient with scarring of extraocular muscles, prior ocular surgery, strabismus or retinal detachment surgery, restrictive myopathy, ophthalmology list separately in addition to the primary procedure. You can see here, one is detachment procedure, another one is only scar releasing procedure. That scar releasing procedure comes in the 343 only. You can read the code description properly, Sunil. Okay, 88.
Sir, if it is same muscle, we can consider 67332.
Yes. You can consider 67332.
Okay, sir.
90th question. What is the doubt? 90th question, Sandhya. A patient excess hormone production due to tumors in adrenal gland. The endocrinologist makes a vertical incision in the middle of the abdomen and removes both adrenal glands.
Sir, in 50
Removes both
modifier, unilateral
50
procedure performed bilaterally, no sir, 50 modifier.
Yes, a unilateral procedure performed bilaterally, 60540. It's a bilateral code description. Adrenalectomy partial or with or without only one side, right? There is no bilateral in the code description.
Sir, I coded B60540, but answer is along with modifier 50 they gave, sir. So I got
See
confused.
that what I am saying, both adrenal glands they have removed. That means left and right they removed.
Yes, sir.
Then what is the modifier?
50.
50 modifier.
Okay, sir.
My doubt is here they didn't give one side right or left like that, no sir. So
Where?
in question, production due to adrenal gland.
Okay, both glands they have given or not? A 90. Both
Removed both.
adrenal glands.
Yes, sir.
Removed both. That means left and right they have removed or not?
Yes, sir.
Okay, then if removed both, then what is in the code description? Is there any adrenal glands? Or in the code description is there any bilateral term? No.
No, sir.
That's a unilateral code description that performed bilaterally. Then what is the modifier?
50, sir. Okay, sir. Okay.
Okay. Now take the answers for 91. 91A.
Mohan,
90. Yes.
can you just check in that only? The parenthetical note is showing for bilateral procedure report 60540 with modifier 50.
Okay, that's what I am saying. A is the answer, right? Okay. Yes, 91A. Take the answers first. 92B, B for Bombay. 93A. 94C. 95B for Bombay. 96 D for Delhi, 97 B for Bombay, 98 C, 99 C, 100 B for Bombay, 100 B for Bombay. Out of these 10 questions, can you text me how many you scored? Okay, 91. Any doubt? Read the code description first. First, what you need to do is when you are doing these big questions, first try to see what is the procedure name and read the code description and then go for the answer and go for the scenario. If you read the procedure performed stereotactic biopsy from left breast, then rule out option D, rule out option C, and rule out option A, then stereotactic biopsy comes under 19283. Yes or no? Understood everyone? Those who scored out of 10 minimum 7, they are going good, they are coding good. Less than 5, need to think everyone. Question number 91, any doubt? The key term is stereotactic. Okay. Question number 92. Question number 92. See here you can see they are placing external fixator devices. External fixation is not a part of the treatment. You can code it separately. Then next question number 93. In question number 93, A is the answer. It's a straightforward question. Placement of IABB, right common femoral artery. What is the key term here? Right femoral common artery. That is the key term. That is the key term. It will be very easy if you read the code description first and read the question next. Question number 94. Fissurectomy, not fissulectomy is performed. Fissurectomy. Fissurectomy is going on, that comes under mapping with C option, K60.2. Question number 95. Radical hysterectomy is performed with pelvic lymph node. It comes under the option. It's a combination code we are getting here. B option. 58210. That is the key term. In question number 96, what is? Yes, yes.
Sir, here I have coded D, sir. Option D. D for Delhi.
Yes, sir. Yes.
Already lymph node is a part of the code description, Vishnu. Why you need to code again lymph node separately? In 58210, pelvic lymph nodes is a part of the code description or not?
Yes, yes.
Why we need to split and code separately? Combination code is there. Next question number 96.
I have coded because 96.
This
obturatory nerve dermflex vein. So
that
the
is
procedure
nothing but extensive. Already combination code is available. You cannot split the code separately for lymph nodes. Radical hysterectomy itself indicates extensive. Not only the uterus, arteries, veins, lymph nodes, everything they will remove.
Okay. Okay.
Sir, actually, here they gave obturated nerve. They gave no, sir. So that's why 3800.
Whatever it may, we all are included in that uterus only. 38770 not coded separately. Why? Because the main for that code is lymph nodes. Yes or no?
Yes, sir.
Lymph node is already included. Next 96, question number 96. It's an unplanned return. Unplanned return. Now understood here this question, Vishnu. The previous question is a scheduled treatment. This is an unplanned return because of complication, post-operative complication. Then what is the modifier? 78 modifier. Is that clear now, this question?
Yes, same computer mistake, sir.
You give 58?
No, 79 I have given.
79 means, that means just go through the modifiers again. Unrelated treatment in the post-operative period. But here, related treatment they are performing regarding the previous surgery. A person went some surgery and that related treatment regarding that surgery, unplanned visit they are performing, it is nothing but complication. Unrelated treatment they are performing in the post-operative period, then 79. It is stated clearly in the first 2 lines. Just check. Next, question number 97. Here, tomographic is the key term. And then they ruled out myocardial infarction. Option A and C blindly ruled out. See, there are three approaches. First, you can see post-operative diagnosis, procedure performed. Then read the code description. Then easily you can rule out the options. Option A, C will be ruled out. Then the key term is tomographic or planar. Here, tomographic method is performed. Question
Yes,
number
okay.
98. Question number 98. Now you can see here option A, B, C, D. All are outpatient E&M codes. Outpatient E&M codes. Now we need to check only the MDM level. Pulmonary hypertension etiology is not clear. That means undiagnosed new problem comes under moderate level. What is the level? Moderate level. Write down somewhere.
Sir, once
Undiagnosed new. How many of? Yes, yes.
Sir, once open the table, sir, please. Outpatient NM table. Sir, I'm coding wrong, sir. In only this table I'm facing situation. I'm not getting understand how to rule out.
Yes, sir. Once explain the table, sir, clearly how to rule out 203, 213 and this 214.
I'm trying, but I'm unable to understand this concept, sir. This table I'm unable to understand how to differentiate. Here it is there category 1, category 2, any combination of 3, and is there as a more self-stable chronic illness that I'm not able to get, sir.
Page number 16, sir. 16.
You can see the table here. First, don't see about this third column. Okay, try to focus initially on number of diagnosis and management options. Understood, everyone? Try to focus only on number of diagnosis and management options. In plan, if they said they're going to perform a major procedure with risk factors is there, then it may be high risk condition. Always go by the treatment method. You can understand the what is the type of diagnosis there. Understood what I am saying? In plan, you can see here they are going to perform a major procedure, and they said already there are some risk factors in performing that procedure. In plan, then definitely the condition may be high risk, then go for 205. Or emergency basis they decided to perform the surgery, then also the condition is very critical, that's why go for high. Or if they decided the patient based on his condition to admit him into the hospital, then also definitely that condition may be risk high, life-threatening condition, coded as high. Or if they documented do not resuscitate, that means no further treatment for the patient, then also there are some critical conditions, then go for high. Now understood? Forget about this middle column as of now. Understood, everyone? Based on this plan, you can go for high. Is that clear now? See, when a physician can decide for a major procedure, definitely there is a life-threatening condition. Yes, Vishnu, now you understood here based on this management option for high
So
when we can take it.
So in question, so in plan, they will mention any one of these case in third column.
Yes. Then you can decide. See, initially, why? Because you people are not exposed to E&M. That's why I'm giving a little bit simple method for you. First, try to see the plan. Okay, what is the plan there? they're telling that if a patient wants to admit into the hospital, definitely when a physician can say like that, you need to admit into the hospital
When there is
because
severe
of some
condition.
life-threatening condition, yes or no? Then comes to high.
Okay.
Like that, no, don't see this third column, this review of data, no need for you. They are not asking that much difficulty. Just focus
Correct.
on this management option and this one. Okay. If you go for moderate level, prescribed medication in plan, prescription of medication, that is one scenario. Next, if they are decided to perform minor surgery, but they identify risk factors, they decided to go for major surgery, but there is no risk factors. Any counseling is provided to the patient, that comes to moderate level. What are the factors comes under moderate level? Prescription of medication, any minor surgery with risk factors, major surgery without risk factors, then counseling. Okay, understood?
Okay, sir. Here my
Now
question
here
is,
you can come. Here you can come here. Can you see here clearly undiagnosed new problem with uncertain prognosis? The etiology is not clear for the diagnosis. Yes or no? If you see
and
pulmonary hypertension, the etiology is not clear, right? If you see in the code, in the question, pulmonary hypertension, etiology is not clear at this time. Or if you are having any two chronic conditions like hypertension, ESRD, any two disease condition they documented as stable, then also moderate level. Any one chronic condition is exacerbated, acute congestive heart failure, like that, any some condition exacerbated, then you can go for moderate. Understood now? Then if you go on to low level, write down there, physical therapy,
implants, sir.
occupational therapy. Under low management you can write down. I said already, I think. Under low management you can write down physical therapy, occupational therapy, occupational therapy, OTC drugs, that means without prescription of the drugs, over the counter drugs, OTC drugs, these are comes under low level. Now if you see the scenario here, 98, clearly they said will evaluate patient sleep study, etiology is not covered, will work up. This not comes under low level, this comes under moderate level. This condition is mapping to etiology not clear, mapping to moderate level. Now if you see question number 99, if you see A, B, C, D options, first we can rule out with modifier. As I discussed, 57 modifier is used for major surgery if they want to perform the same day or the next day. What is the modifier? 57 modifier. 25 modifier is used for distinct procedures, minor procedures. Can you see what is the procedure performed here? Minor. That means I can rule out 57 related one, B and D. Understood, Vishnu here?
Yes, sir. Yes.
Okay. Now A and C. Now I need to check for whether new patient or established patient. Go for the starting, coming after 4 years. New patient. Then what is your answer? New patient. B is the answer.
Yeah, C, sir.
Definitely there is some, sorry, C is the answer. There is some hint for you, Vishnu. Try to read the table first. Management options. Okay, why this management is providing? What is the disease condition? If it is management is providing, go for hospitalization, admit, or you need immediate surgery, then definitely the condition is high risk. Like that you can see. Question number 100, you can see Question number 100. Now, if you see, these are consultation codes. What are these codes? Consultation codes. A, B, C, D. Now, 2 are inpatient consultation, 2 are outpatient consultation. Now, as we know, if a patient is admitted into hospital or the patient is in SNF, we can use inpatient consultation codes. If you read this scenario, you cannot get like that the patient is in hospital or SNF. Rule out option C and D.
Yes, sir. It is
What
outpatient
are the
consultation.
remaining options with you? It is
A,
A
B.
and B. A, B. Now, in that A and B, you need to find out your answer. I told you the table to memorize. I told you the table to memorize. Physical examination 224, 527. As I said, that points for you all or not, you can check everyone.
Sorry, sir.
Physical examination. History table, physical examination table. I said for you, batch. Just check everyone.
Not getting, sir. Can you tell me?
No. I said for your batch, Vishnu. Anyone in the class?
No, sir.
No? Okay. Then you can leave this question. That will take for me almost 30 to 40 minutes. Okay. That I will tell you in the coming week for you. First, I will tell you the table. Okay. Except this question, any other doubts for you in this paper?
80. Mohan.
Yes, what's your doubt here? How the baby is delivered? The first baby is delivered through vaginal. The second baby is delivered through C-section. Antepartum and postpartum care is provided by the same physician. I told you already the rule. First, you need to quote the surgery, followed by vaginal delivery. What is your answer here, Anupama?
No, I wanted some explanation about that answer. It is given C is the answer.
See, I have given already examples in notes with rules. Okay, anyway, you can see here. Twins are going to deliver. If both the twins are delivered through vaginal, 59400, 59409, 51 modifier. Just go with this. If both the babies are delivered through C-section, only use the code 59510. This is a rule. The third point is one baby is vaginal, one baby is C-section, then code first C-section code 59510, 59409, 51 modifier.
Okay.
59409, 51 modifier.
Okay, so we don't need to code separately the cesarean delivery.
Already we coded cesarean delivery in 59510. The code itself indicates cesarean delivery. 59409 indicates vaginal delivery. Okay. Now I will ask the admin person to arrange a 30 to 40 minutes class in this week. Okay, based on my timing. I will teach E&M for you, Vishnu, the table and the further tables. Don't worry. Okay.
And Mohan Venus family is also remaining.
Okay.
Venus family coding.
No need. We are not getting any questions from Venus families, only arterial family. But anyway, I will teach you that one also. 40 to 50 minutes class I will take only on E&M and that Venus family. Okay. E&M that to table. Understood, Vishnu?
Okay, sir. Only table only
within,
not get. Okay,
within the tables, I will explain 30 minutes session. That Venus family only the codes, no issues. 30 to 40 minutes class I will take in this week, most probably on Wednesday or Thursday. Okay.
So also on the same day, you have provided us the chapter-wise question papers, right?
Okay.
So in that, after seeing the rationals also, some doubts are left.
You are having doubts? Okay.
Yeah.
You can mark Vishnu. Okay. Why? Because I have some meeting by 9 o'clock today. That's why otherwise I can take today itself. Complete the third mark in this week. Maximum I cleared your doubts. I hope so in this paper. Still remaining, you can ask me. One day I will ask the admin person to arrange a class for
Sir,
30 to 40 minutes.
sir, these abbreviations where we can check, sir?
In the CPT book starting. CPT book starting. That we need to see, Kalpana.
Sir.
Out of 100 questions, Kalpana, always keep in mind, we know only 90. Everyone, even the paper who made that one, the person knows everything. Otherwise, all the people knows only 90. 10 questions always kept as a buffer. Okay, Kalpana?
Sir.
If you understand that if you apply some logic, you will understood that 10th question, 10 questions. Otherwise, you can keep it as buffer. Your thing is, okay, I will know only 90 in the paper. I need to be accurate. I need to do 70 out of 90. Okay?
Sir,
Try
these
to
10
make
questions,
your mind like yes.
in below 90 questions, only some abbreviations are there, no, sir. So because of that, we are not able to identify the codes.
1 or 2 questions, Kalpana. Out of these 90 questions, how many you got like that? 1 or 2 questions, right?
1 or 2. Yes, sir.
Sometimes we may know that abbreviation.
Sir.
Sometimes we may not. Okay. Don't think about that one. But anterior cruciate ligament, ACL means. It is at knee. You will get in the CPT book, go with ligament as the main term. Okay, in the index list. But what I am telling to is, 1 or 2 questions you may get like that. That means it will be, you don't know that one. No need to think about it. Okay, do the remaining questions. Okay.
Yes, sir.
Why? Because we are having 30 questions buffer, Kalpana. Out of 100, we need to score only 70.
Not
if you know 70 you put,
in interview also they are asking, sir. Last week they have asked about MRSA, sir. MRSA.
That is methicillin resistant staphylococcal or yes bacteria name. Okay, the abbreviations you want.
Yes, sir. Yes, sir.
I will ask the admin person to share you the anatomy book for you. Okay, you just go through it. Already the LOA material we shared for you.
Yeah, is there, sir.
Then also you can find each and every abbreviation in that one. Vocabulary will be there for every chapter. If you want to attend for any chapter, go for vocabulary. Okay, you will get it. It is a very simplified version.
Okay, sir. Thank you, sir.
Thanks everyone. Complete this week third mark paper. I will ask what admin person. Yes.
Sir, I completed mock 3.
Okay. Priyanka, when is your exam?
27th Feb, sir.
27th Feb. Can you ask the admin person? He will schedule on one day so that I will clear your doubts. Okay. Thank you, everyone. See you. Complete that mock paper, third, and then the 30 to 40 minutes definitely I will take on one day this week. Okay. Thank you.